welcome neighbors, business, public, leaders, community members. We're thrilled to be here and excited to share our plans with you, answer your questions. But before I start, I wanted to introduce some folks. With Meridian, myself, I'm John Seymour. I'm the Vice President of Marketing and Business Development. And Fran Savageau is Meridian's CEO. I've got Doug Hennis. He's the VP of Government Relations, University of St. Thomas. And Peter Beck is with Beck Law, and he is a land use attorney. With that said, a couple of things I wanted to highlight. And first off, does everybody should have an agenda, kind of an info sheet, if you will, two-sided and an aerial? A couple of things before we get into it. I mean, our intention is to establish Gainey Center as a world-class state-of-the-art residential treatment center in Owatonna. It's, you know, from the moment we saw it, we thought it was ideally situated. It, provides privacy and anonymity for our clients, which is very important to them, and the neighbors as well. Meridian, as I'll get into, is a leading provider of substance abuse treatment services in the state. The clients that we're going to be working with at this facility are working professionals like you and I, licensed doctors, lawyers, dentists, and pharmacists. State-regulated, state-operated facility with all the protocols that go with that. And then we have no intentions of redeveloping the property, and we look forward to being a member of this community. Any questions before I get into this? How many neighbors do we have? Yes?
I just have a quick question.
Yep.
We have our horses out there right now, and so we came to see if you've made any decisions on that, if we will be moving.
Let me do this. Let me get through this, let me go through a little bit about the background, and can we get to that later? Is that fair?
No, we do want to talk to that issue now.
So have an agenda here, and I mean, really, at the end of the day, this is about sharing our intentions of the projects, answer questions. I'll go through a quick, the background of, why Gainey, and background around Meridian, background around the program, the clients, and talk a little bit about next steps. So if you have this, anybody who's been to Gainey Center? Okay, so you, on this, you see where this is, pretty secluded. Gainey Center, what is this, 45?
Yeah.
Okay. So for about 18 months, we've been looking for a place where we can provide state-of-the-art residential treatment. I think we found it. To that end, on May 6th, we signed a purchase agreement with the University of St. Thomas. The Gainey Center is, you may or may not know, is an 180-acre property that is gifted to St. Thomas by the Gainey Foundation in 1979 and opened in 1982 as a conference and retreat center. Meridian proposes using the existing Gainey Center as a supervised living facility providing residential treatment programs. But before I get into the why Gainey, I thought I'd love it if, I know Fran, you had some thoughts, and Doug, I know you have thoughts.
Thank you, John. As John mentioned, my name is Doug Hennis. I'm Vice President for University and Government Relations at St. Thomas. I actually am an Owatonna native. I grew up here. We're on the west side, right across the street from Gainey Park. And until last fall, my parents lived here. So I know the community well, and I love coming back here. I've been at St. Thomas for 24 years, and I've been down to Gainey for many retreats and workshops and meetings. So I'm going to miss it for one. But in February, our board, after having looked at Gainey's position in the market and the way the conference services market has declined over the past decade, and the fact that we were losing money, more and more money every year, the board decided it was time to sell the property. It wasn't core to our mission as a university. So we made an announcement, as you're aware, in sell the property, and we expected to begin marketing it this month. And then we were approached by Meridian, and things moved rather quickly from there. And it was a great surprise. We thought it might take a year or two to find a buyer for it. That said, we're really pleased with Meridian as the potential buyer for the property, hoping the purchase agreement goes through okay, and they're able to close and open their facility. We think it's a great reuse of the property. When we decided to put it on the market, we honestly didn't know what kind of interest there would be. I don't think, frankly, we thought of a treatment facility. We thought maybe somebody might be interested in coming in and running as a conference center again, or perhaps senior citizens housing, or even a developer might want to come in and develop the area for housing. Or I suppose it could have gone back to farmland, which it was 70, 80 years ago. So the fact that we were able to find an interested buyer this quick was a surprise, but a very pleasant surprise to us. And we are in full support of what Meridian wants to do. I'd be happy to answer questions later. Thank you.
Thanks. Good evening, everybody. My name is Fran Savageau. I'm the President and Chief Executive Officer at Meridian Behavioral Health. It really is a privilege to have a chance to be here with you guys tonight to talk about plans for Gainey Center. We came specifically for this kind of forum. We know that on June 2nd, we're going to have a chance to sit back in this room again and talk planning, and then ultimately, if approved, we'll get a chance to go in front of the commission in July. We're extremely excited about the project. We've been, as John said, we've been looking for a considerable amount of time to find what we think considered to be the right space, and frankly, we couldn't be more pleased than what we found with the Gainey Center. It's a beautiful aesthetic setting. It'll be a pastoral environment for individuals to find sobriety. As John had already indicated, the kind of client that we're going to be dealing with is going to be folks just like you and I, professionals in the community, individuals who are insured, folks who are not remanded to care but who have made a care decision to try to seek sobriety and hopefully maintain that sobriety long term. We offer a very specific treatment model that's multidisciplinary treatment in its approach, physicians on staff, mental health professionals, psychologists. In fact, we believe that the gentleman who will ultimately be the director of the program will be a PhD clinical psychologist. State-of-the-art programming. We look to do a variety of different kinds of dynamic service to include a number of modalities of care. And as I said, we're very, very excited to be here. The purpose of this evening is to answer any and all of your questions forthrightly and honestly. We are very compelled to try to make this happen. I think it's certainly in the best interest of Meridian Behavioral Health. I believe it will be in the best interest of Owatonna and Steele County. I've appreciated the support of Mayor Tom Kuntz and all the work that Ulman's already put into it for us in terms of city planning, or county planning, excuse me. But frankly, that's why we're here tonight. We're here to answer questions. I will tell you that I've been doing this 35 years, had the good opportunity to manage facilities in 24 of our 50 states. Rarely have I found an opportunity as perfectly suited to do this kind of work as we find in the Gainey Center. There's going to be very little renovation that's going to have to be done. There'll have to be some work with some of the sewer system's going to need some work, but ultimately the building sets up beautifully for what we do. I like the seclusion, as John's already said. We have no intention of redeveloping the property or breaking the property into pieces. We like all 180 acres, and as I said, we like the pastoral effect that it has. I know it's going to be an outstanding place for individuals to find sobriety. So John's has a little more formalized portion of the program, if you will, and then I would ask that any and all of your questions be directed to either John or Doug or I, and we'll answer them forthright. Thanks.
So Why Gainey? I mean, we talked about it already, but, you know, it's the majesty, it's pastoral. It's really ideally situated for therapy. It's conducive to therapy, if you will. As I mentioned, it's on 180 acres, and if you look at it, pretty secluded, you know, and people, when they're seeking sobriety, want anonymity. So that is another tremendous plus for the program, for the facility. And it's pristine, so which allows us to attract a higher end clientele. And then lastly, you know, it's got a built-in wellness. I know you thought that it doesn't have a huge gym, but it's got, you know, a gym already in it. It's got walking trails. It's got tennis courts. You know, it's part of what we do. It's wellness. It's a whole body approach. A little bit about Meridian Behavioral Health, founded in 1989, leading provider or a leading provider of substance abuse treatment services in the state. We've got 7 residential programs, 1 medication-assisted treatment program, and 12 outpatient programs as far north as East Grand Forks and Meridian. On any given day, we treat or serve 1,500 patients in one of our programs. We're dedicated to healing and recovery, and over the years, we've helped thousands of men and women rebuild their lives and achieve sustained recovery. We have a strong clinical reputation for providing high-quality, safe care. And our philosophy, and I think this is somewhat of a testament, is to enter a community as a partner, working closely with clergy, public safety officials, social service agencies to ensure the health and safety of its residents, staff, and the community. So that's a little bit about why and who we are. As far as the program, we want to develop a state-of-the-art 65-bed residential treatment program for working professionals who suffer from substance abuse and addiction. It's a state-licensed facility with strict documented protocols, policies, and procedures for providing high-quality care. There will be 24/7 supervision by licensed professionals. We'll have a staff of about 48 professionals that range from mental health practitioners, nurses, maintenance staff, and we would like to hire largely from the local community, if possible. Residents will be part of a highly structured program, you know, literally from 7 to 7 at night. Services and programs span substance abuse, mental health, care, therapy, wellness, and healthy living, relapse prevention, lots of different programs throughout the day. Meridian, and as I mentioned, not only employees, but we want to source what other resources we need from the community. You know, as we look at developing it, you know, office supplies, you name it. That's what we want to be able to do. As far as our clients, I mean, Fran mentioned it, they're people like you and I. You know, they're working professionals who need help and are seeking sobriety. And I want to emphasize, these are not the court-ordered folks. These are there voluntarily. These are folks that are seeking sobriety on their terms. They struggle with addiction, and they know they need help. They also need help, and that's what we provide. Each client receives a thorough examination and assessment, and if they indicate they're not there voluntarily or are deemed to pose a potential threat to themselves or others, are not admitted to our program. As far as next steps, we have a planning commission meeting, and that's where we are presenting, and Peter, you can jump in as well. It's really a proposed change to the ordinance to allow our use in the agricultural zone, and then we're looking at a conditional use permit. And then if that, you know, is endorsed, then we go to the county board on the 8th of July, yes. But that's all I have as far as kind of a snapshot, again, of who we are, Gainey types of clients, our protocol and policies. Any questions? Yes, ma'am.
In the literature, you keep stating it's for substance abuse.
Yes.
Does that mean you would not take persons addicted to, say, gaming or pornography or
No,
any
it's
other
a
type of
different
addiction?
license. It would only be for substance abuse.
Okay.
So I'm assuming you're only taking people who have insurance, you won't do any below
Correct.
25?
Correct.
Okay.
Yes,
Exclusively, or
We-
self-pay.
If you go on our website, we made our bones, our career, working with Rule 25 assessments, and a lot of the work we do in the Twin Cities is with that population of clients. This is not that.
You're not going to do
no,
that here?
no,
Yeah,
we're
I
not.
remember what you did in the metro.
We specifically have been looking to move up the socioeconomic spectrum of care. Of course, we've been fortunate to have the opportunity to find a Gainey because it provides an environment that would be conducive to that kind of aesthetic surrounding. And
And appeal to those types of clients.
yeah, and so the bottom line is that this is a new product line for Meridian Behavioral Health. It's not a product line that we're not familiar with professionally, but it is probably a new product line for us in the state of Minnesota.
And are you going to be looking at hiring ABCTs as well as LABCs?
Yeah, it's the same, it's a Rule 31 license program. So the same policies, procedures, staffing, licensing would apply.
Okay.
Did I answer your question? Okay.
Other questions? Sir?
How many clients do you anticipate handling at Gainey Center?
Okay, it is, it's part of what we're seeking approval, it would be for 65 clients. That would be the maximum. Yes, sir.
You provide a number of outpatient treatment programs throughout the state. I saw on your site, as well as detention center programming. Are there any plans or discussions to do any of that in the future?
No.
No, no, so residential, not outpatient.
That's our plan at this
Yep.
point, is to do residential services here at this facility. Well, as we do as the draw that we ultimately do, from and seeking the clients that we will be seeking, in very many cases, the outpatient scenario won't be real. Normally, we try to move outpatient clients back to an environment that's, it's close to home, close to family, close to work, church, and there'll be clients that access care here, Owatonna won't be home, or, that kind of thing.
Just to clarify that, not only is that the plan, but the ordinance we proposed would require the people receiving treatment to be living on the property. So that's, we prepared, or we are proposing an ordinance very specific to the program that Meridian is proposing, so that in the future, it can't become an outpatient or day use clinic. Everyone receiving treatment lives there.
It can or cannot?
It cannot. Everyone who's, we have proposed two things here. One, we proposed an ordinance amendment to allow this use. And in that, we have crafted it so that it's pretty much just this type of facility, and they will need a conditional use permit under that ordinance. And again, in the conditional use permit, there'll be additional conditions, but you don't even have to get that far to be sure that it's a residential facility, because the ordinance says that it's for treatment of persons who are living on the property.
So your staff will not be providing services outside the grounds of the Gainey Center?
No.
Are you going to have an outpatient person on staff working with, like up in the cities?
We'll have case managers.
You're gonna have,
We'll
yeah,
have
your
case
case
management
managers.
responsibility that will make sure that folks are appropriately
Yeah.
triaged. And frankly, we have outpatient programs, throughout the state. Obviously, our hope would be that these individuals would be, depending on, frankly, it just depends on where they live, where we
Right.
get them from. But if we could keep them inside the continuum of care by stepping them down into one of our Meridian outpatient programs, that certainly would be that would certainly be what we'd like to do, but we're not going to do that. We're not doing outpatient programming at the Gainey
So,
Center.
as we like to say, when clients are admitted, continuing
Right.
care plan begins at the point of admission. So a counselor, before a client is discharged, will be identifying the appropriate step-down or outpatient programming, whatever it might be. That makes sense.
Yes,
For
ma'am.
those who are from the local area, will you be referring them to the local outpatient program center
Yes, ma'am.
versus Meridian program with the cities?
Yes, ma'am. That's what, frankly, understanding that there are a number of providers of outpatient services, there's also someone who does a similar kind of treatment that we do in some of our facilities in the state. We hope to create relationships with care providers to create, to be a good community citizen and a good care citizen. Relationships with the medical surgical hospital, it's right up the next exit up, and but understanding how we do what we do. We need our community partners in order to be successful.
Yes.
And the population that you'll serve will be confined to adult?
Yes.
Yes, ma'am.
Yep.
There will be co-ed, there will be men and women.
Yes, sir.
You had shared some dates for approvals. Is there a date at this point for closing and for Meridian to take possession?
I think around August 4th is when it tentatively is set.
If the approvals are.
If all
Right,
the,
if all the approvals.
if all the contingent approvals are approved, sir,
Yes.
then August
Yep.
4th would be that's our working day, as of recent conversation.
And then maybe I'd refer this question for our gentleman from St. Thomas. I'm a resident of the property, one of the tenants. When would a notice be given to tenants if they have to leave?
I think once we determine when the closing date will be on the property, it's dependent on who moving through the process with the county, first with the planning commission and then the county board. If the county board ultimately approves the zoning changes in the CUP on July 8th, then a date will be set for closing. And at that point, we will notify people as to when the closing will be and when Meridian will be taking over. I can talk separately with you, though. I mean, I think you have a sense here as they're talking late August or late July, early August, if things move forward on the schedule.
Why don't we get your name so we can make sure we're good?
I guess it's a concern, obviously, that we have some notice and the family don't need to relocate.
Perfect.
Yes, and I would like to get your name and have our CFO follow up. Thank you.
Best not to read about it in the paper.
I understand.
Do you have another question? Or not to pick on you?
That venue, any possibility of being that inclined there?
That's a very good, and then we can segue into the question from the young lady in the back. Our plan right now is to try to maintain the stables in minimally in the condition they're in, and then improve the stables, and we have every hope that we'll be able to extend the renting or leasing relationships with the current folks that rent or lease the stables. And in fact, I've had great success in the past, most specifically in a care facility in Missouri with equestrian therapy, and it's something that we're very interested in. Finding the right clinicians or finding the right therapists to be able to provide the service is not like rolling off a log, but it is a very, very dynamic and it's a curative therapy that, especially with individuals suffering from significant issues or with addictive disease, that it really has worked wonders. A lot of where I had the greatest success with kids and adolescents. That's not particular or germane to this conversation, but I've seen some amazing things happen with equestrian therapy or equine therapy, as you call it. Yes,
As
ma'am.
far as that equine therapy program, what kind of requirements or how would we know what would be available to be applied for? I'm part of the posse. My horses go through extensive training to be part of crowd control, to be around people. We are, as a posse, part of the special horses, special people in Waseca. And so to be able, I just would want to know what else I could do to make sure that myself and my horses could possibly be part of the program.
As we move into this process, we're going to be advertising each step of the way what we're looking for from community resource. And John touched on it. pride ourselves on being good community citizens. We're for-profit, so we'll create a significant tax base. We're looking to recruit individuals from the local area in order to fill the majority of the slots that roughly 48 professional slots that we're looking for. There are a couple of members of the St. Thomas crew right now that we're obviously invested in trying to have a conversation with. But we are members of historically, we're members of the Chamber of Commerce. We like being your neighbors, but we also would prefer to be the neighbor that you don't hear much from, to be perfectly candid. Because frankly, these folks that come to us, they come to us oftentimes the lowest point in their life, and they, in all candor, they're really, really desperately seeking anonymity. This is a disease that's a very personal disease, and so these folks are not individuals who are going to be wanting to, they're not going to be taking a trip to Walmart. I mean, these folks are coming to this sequestered environment in order to find sobriety in an anonymous situation, and then frankly go back to the homes and the churches and the jobs that they've left. One of our specific programs is going to be what we call an impaired professional program, and with that we'll be working with airline pilots and doctors and pharmacists and lawyers and nurses, anyone that you can imagine that has a license to operate or to do the job that they do, that has put that opportunity or that license at risk because of their addictive disease. And then whether it's the Minnesota Medical Association, or whether it's the Board of Pharmacy in Minnesota, whether it's the airline pilots union and the employee assistance programs, whether it's the Minnesota Bar, they've made a decision that these individuals are going to have to find treatment and have to maintain treatment for an extended period of time before they're going to be able to get back to doing their job and get back to their life. That's a program I've had success with also in the past, specifically in the state of South Carolina, and that's that will be one of the key program tracks that we expect. Probably right now, if we look at it, we expect 13 of the 65 beds to be dedicated to that very specialized program. Sir?
Yes, sir.
If your organization were in the future to wish to change the nature of your services and clientele, what public venue or process would be actuated to give the public awareness and opportunity for it?
I'll let Peter speak to that, but we'd have to go through the whole planning and approval process.
As I mentioned earlier, what we've done is proposed to the county an ordinance to allow pretty specific to this program. So if someone wanted to do something different, for instance, a program where the clients didn't live on the property, they wouldn't just have to get a new conditional use permit, they'd have to get a new ordinance. If someone came in with the identical program, the conditional use permit does run with the land, so that could happen. That's very unlikely. Almost anybody, if Meridian discontinued its operations on this property and it was acquired by some similar business, in all likelihood they would have to go through at least a conditional use permit process, which is a public hearing process at the Planning Commission. And again, if they want to change any of the fundamental things like an outpatient type program, they'd have to amend the ordinance. So that's one of our goals here has been to be as narrow as we can be so that the community knows what they're getting and they know that's what it'll be for the long term.
Did that answer your question?
Yes.
Yes, ma'am.
Is this a straight 30-day program, or is there?
No, it's not a 30-day program. It can be, but it's really customized to the individual needs of the client. We see lengths of stay sometimes as much as 45 to 60 days, and we see lengths of stay as short as 16 to 20 days. This is, now, once again, understanding that it's a voluntary process and that individuals come to us voluntarily, they've made a commitment and a decision that they need help. I can't force them to stay for that length of time, but it normally takes to successfully complete the program so that when you're discharged with staff approval, which is one of, WSI. It's normally gonna take you probably, if you're really exemplary, in terms of, the efforts that you make and the programmatics that you follow, you're probably looking at about a 4-week process now. But it's not a cookie cutter. It really truly is, especially at this level of care. It truly is a physician-driven, multidisciplinary treatment team approach and decision in terms of what's going to make the most sense for the client that we deal with, each individual client.
There's not a prescribed set time, it depends on.
In the old days, there used to be the 28-day program. I've been around long enough to remember those. That's not how we do business anymore.
Yes, ma'am?
How will you reach the 65 capacity? I think there's like 30 or 35 rooms there.
Some
Are you
will have
using
double, yeah.
the
they'll have double.
houses?
What's that?
Are
No,
you
it's
using
all
the-
gonna be at the Gainey Center.
So double in the rooms?
Yep.
That's what you do?
Yep.
Okay.
It's all gonna be housed at the Gainey Center. Yes.
So when you're talking about that you're looking at, horse therapy with Meridian, are you branching out into different modalities? And
Yes, ma'am.
looking at possibly, do you include music therapy? Are you including yoga? Are you including the more natural,
Yes, ma'am.
holistic aspects?
Like you read the brochure. But yes,
Like I've
frankly.
been reading online.
Yes, ma'am. I mean, the bottom line is that in order to really do body, mind, spirit, there's an
Right.
awful lot of things that
Yes.
are going to have to be
Right.
provided, and whether they're provided on an ongoing basis or whether we provide access to the service. For instance, there are individuals who get a tremendous amount of relief, especially early on, from acupuncture. And so things like that would be, we would make sure that there was I probably won't have an acupuncturist on staff in all candor, but we will make sure that we can, a couple times a week, we'll have somebody drive from wherever we find a qualified individual to be able to offer to provide those kinds of services. Massage therapy is another one of those. And once again, this is a tough time in people's lives. If we can make it as comfortable as possible for them, from psychopharmacotropic interaction to any kind of care modality that makes sense, that's what we're gonna do. Because the other thing too is that when you do this kind of work in this kind of Gainey Center, not only are these individuals making a decision, but it's an expensive decision. I mean, this could cost some anywhere from $675 to $1,200 a day, depending on the level of intensity. So these folks have made, are going to have to work hard, but they've made an expensive decision. That's the best way to describe it.
Because I assume you're going to take private pay.
We will take private pay and commercial insurance, and that's going to, and once again, we have, ample beds throughout the state to make sure that we treat it. We're not moving away from our core business. I don't mean to insinuate that for a second. What we're doing here in Gainey Center in Owatonna, Minnesota, is a different level of care.
So why the choice to do the different level of care here in Owatonna versus what's offered in the metro?
Really because we've been looking, we wanted to step into this level of care for quite some time, and we've been looking for the right venue, the right setting. And I drove up to the Gainey Center, and from the time I hit the gate and started down the path, I was like, okay, we get this. How can we try to make this work? I mean, and then you walk through the University of St. Thomas has maintained it so impeccably. I said, I'm moving the headquarters down. No, I'm not.
Teaching the yoga class.
Right, yeah. I got the conference room picked out for my office anyway, but it's been. Pardon?
We've got the perfect location.
But anyway, we're very, very enamored with the opportunity. But we did not make a decision to do this based on the Gainey Center. We looked for the Gainey Center to do this piece of, to do this kind of work. Yes, ma'am. So, ma'am?
Will there be family involvement, family visitations?
Yes, there will, sir. Yes, I mean, it's extremely important to the process is family involvement. And so oftentimes that's a very easy thing to do, and other
site, or will they be housed off-site then?
They would,
The family involved?
they would come and visit, they would not be on site. No, they would come for visiting hours, and they would come for therapeutic interactions and groups, family-oriented groups, and then they would stay in local motels or hotels and that kind of thing. And
Yes,
that's what,
specific policies in place as far as.
yes, ma'am.
The Gainey Center is 180 acres, and that, the campus part is way smaller than 180 acres, so you plan to continue renting the outlying land? You said you weren't planning to do any development of it, or you plan to be using the entire part for your program?
You know, that's an interesting question. We haven't made that decision yet. Let me make sure I clarify what I just said. We are not intending to do any kind of redevelopment or subdivision of that property whatsoever. What we are probably going to do is have that 180 acres for ourselves. But I'm not completely, not the stables, guys, so the stables we've already talked about. But I'm not quite sure. We'll look at every, first of all, we gotta get our arms completely in due diligence around what the relationships look like on that property right now in terms of, what's being leased, what's not being leased. But, I'm gonna take everything individually and deal with each situation with the correct leasee, that makes the most sense for us in the community.
So
We
the
really-
the houses then that are currently being leased, then you will probably continue to lease them?
No, ma'am, I don't
No.
know. Well, I said we will deal with those individually. Probably gonna have, I don't think we're gonna be able to continue to do the leasing of the homes. It's too close to the care model that we're delivering, and frankly, it defeats my purpose of, I don't mean this in a negative way, but John Q. Public is living on the grounds, then it defeats the anonymity of purpose for clients and companies.
My family rents the hay ground on the Gainey property,
Yes, ma'am?
and the rent has been paid for this year, so for this time, everything will go on as is?
Yes, ma'am.
Okay,
Yes, ma'am. And once again, I'm not ruling out renting it to you again next year.
okay.
I just had a guy call me on the phone this morning going, hey, who's paying that property for you? I'm like, gee.
Don't give it away, don't give it away.
I told him, but I mean, it was, so the word definitely is out, though. So-
Paying that
I know,
property.
Welcome to rural Minnesota, right?
But you'll probably, Fran, what you need to do is, get from St. Thomas a list of the folks and
And we have that, we do do.
reach out to them.
We have
As you know, if the process is successful and it came to fruition, then I think that we need to be reaching out to all of the lessees on land, whether it be houses or property.
Any other questions? Yes, sir.
I'm just wondering about, maybe going into depth on this at all, but obviously, community works together with you. We want to see you succeed.
Yes, sir.
We don't want any organization coming in and being there for 2 or 3 years and not doing well. How did you share this with the county and the city as far as the security of your business plan, that you're going to be here for a while?
Well, that's a very good.
In other words, how do we know you're going to be successful?
Because I am. No. But I digress. Let me say this, sir. I'm not only the president and CEO, I'm also the third largest equity participant in the company. And so, when I came here in February of 2011, and I bought a significant piece of the company, and so basically put my money where my mouth is in terms of the growth and the development of this company. Been doing this for 34 years, at all in varying levels of behavioral health care and medical surgical health care. I'm a pure administrator, master's degree and undergraduate degrees in healthcare administration. It's all I've ever done. that's the other thing too. We're not, we're a Minnesota-based company. All of our locations are currently someplace in the state of Minnesota. Although if you get to East Grand Forks, that really looks like North Dakota to me. It's very close. Yeah, or Canada, yeah. But we do intend to do this model well, because we do intend to brand this model and to ultimately do this kind of care in other settings. So it's a very, very important strategic investment for us. So that's the best way I can, that's the best thing I can
Thank
say.
you.
Yes, sir. Yes, ma'am.
I believe in one of either your model or your press release, you talked about trying to draw employees from this area, and you mentioned it briefly here. And I'm guessing, East Grand Forks is a fairly big area, but guessing you might have facilities in smaller communities such as ours. And do you believe that there will be problems or challenges in finding the workforce, the professional staff that you're looking for in this community?
That's a great question. And I was talking to Dale about this just a little while before we got started. What I like about what I found here, because frankly, when I looked at the map, I wasn't quite sure what I was going to find, and I don't mean that in a negative way. It's just, it's not the Twin Cities; it's down south of the Twin Cities, but we are in small towns. We're in Pine City, which is about an hour north of the Twin Cities. And we do a very, very successful residential program there. We just recently opened a facility in Meridian, which is comparable in size. But I will tell you that when I look at here, I look at Rochester, and Mankato, I look at Albert Lee and Faribault, and then you guys, I don't think we're going to have a problem. I also like the fact that I already know that there's a couple of psychiatrists in town. I know that there's other folks in town that are doing this kind of business. I know that we've got individuals who are practicing professionals in the town that, as I talked about already, I want to be part of this community care network. So I don't see it being a problem. If there is a problem, John and I left New Brighton on the north end of town, and we're here in about an hour and 10 minutes. So I mean, it's my chief financial officer who works in New Brighton lives in New Prague, and she makes that drive every day. God bless her. But it's not the end of the world. You know what I mean? And but I really, when we say we're interested in hiring here and being a part of this community, that's where I like to see the bulk of the professionals come from. I don't have any desire to have to start to import folks from other places. Will I, to bring the right level of professional, if they're not available here, I certainly will. But I'm hoping to be able to do most of that here.
Yes.
Yes, ma'am.
I have a related question.
Yes, ma'am.
And it has to do with, as you go into communities, I imagine some of the communities where you go, there are existing community mental health centers that are nonprofits.
Yes, ma'am.
And can you speak to how the pay scale that you are able to offer to your employees compares and has impacted existing nonprofits?
Mostly, surprisingly, we are normally pretty much on par. We haven't, we have folks come to us sometimes, and frankly leave us sometimes. Some of the things the nonprofit community health systems can offer, we can't offer in terms of, like we don't have a tenure package that a lot of times you can earn out with the state. Frankly, our benefits are probably not as good as the state's benefits overall, because we're a small self-insured company, and we make up for it with maybe an hour, $1 to another $1 an hour, because we have to be competitive. But at the same time, in every single community where there is a community mental health center, we're normally very closely aligned, and we sort of, employees go back and forth. I'm not going to kid you on that, but for the most part, we don't have any rancorous relationships with any community mental health centers in the communities that we normally enjoy very, very good relationships. We pride ourselves. I mean, for us to survive, we've got to be prepared to have the best possible relationships. It's going to be a little bit of a different dynamic here because of the clients we treat, but if you got on our website, sort of who we are in the other communities in which we treat clients. Community mental health centers are our partners in care, and we have a very, very good relationship with them. NP stands for not in my backyard. And so we have had many, many conversations, I have especially over the history of my career with communities. What I will tell you is this: give us the chance to show you what a good community citizen we can be. Give us a chance to be a real participating member of the Chamber of Commerce, to create the tax base that we create. What we do and how we do it, you'd be very, very proud of. One of the things we intend to do very early on is we intend to open up the campus, once we get ourselves situated, open up the campus and invite all of you to come see who we are and what we do. Who you're gonna see is you're gonna see your neighbors, and you're gonna see the professionals that you probably have been accessing care with, during the period of time that prior to us coming here. You're certainly gonna see something that you're gonna be proud of from a community perspective. We're very proud of the opportunity to take the legacy that exists with the Gainey Center and to create something special. We haven't decided what we're going to call it yet. Probably not the Gainey Center, because that could be a little confusing, but we're probably going to continue to try to keep the Gainey name into that if it's possible. But we are extremely excited about being here in Owatonna, and we're extremely excited about the opportunities that are going to exist here as we grow this business. If everything goes according to plan, and it never does, but if everything goes according to plan, we should be looking at accepting our first clients probably by the end of